Health Services of Northeastern Connecticut. Overview of provider. Natchog Hospital in Mansfield Center, Connecticut has a 57-bed facility serving over 650 children, adolescents, and 1,300 adults annually for mental health or substance abuse issues. Established in 1954, it offers programs like day hospital, after school, and special education across Connecticut. Dr. Olga and Dr. Mervyn Little founded it to provide psychiatric care in northeastern Connecticut. Natchog has expanded services, including specialized inpatient units, day hospital programs, and residential treatment centers. The hospital's mission focuses on community-based services, emphasizing dignity, privacy, empowerment, and recovery for patients. Services and command structure. Child and adolescent departments and services at Natchog Hospital offer evaluations for autism and ADHD, along with various treatment options for children and adolescents. Outpatient programs for adults include structured clinical treatment for psychiatric and substance abuse issues, with inpatient care available. The Older Adults program treats individuals age 55 and older through group therapy sessions, individual and family therapy, recreational activities, and medication management. Leadership structure involves Hartford Healthcare's senior leadership, Natchog Hospital's medical director, and the hospital's board of directors. Financial data. In 2019, Natchog Hospital saw a revenue increase of $15,854,335, with total expenses rising to $53,724,401, resulting in an improved deficit. In 2020, revenue was $49,290,258, and total expenses were $55,022,343. In 2021, revenue was $55,486,925, but expenses led to a negative difference. The hospital was maintained financially stable in previous years, mainly through adult inpatient services. Total assets and liabilities have fluctuated over time. Finance and data collection improvements. Hospitals struggle to measure costs at the individual patient level due to healthcare costing complexity and the challenges of tracking savings from patient initiative efforts. Studies show a growing focus on cost reduction in healthcare, particularly in the US hospitals. Lean implementation studies have shown positive financial impacts on revenue by increasing efficiency and throughput. Natchog Hospital collects data using various methods such as digital applications, patient surveys, and clinical interviews. They balance a quantitative and qualitative indicators to enhance patient experiences using mixed methods designed like exploratory, explanatory, and convergent, combined with triangulation for validation and improvement. Theory of change and expected outcomes. Natchog Hospital uses a theory of change to impact the community systematically through the community health needs assessment. They identify priority issues, allocate resources efficiently, improve resident health, and increase accessibility to preventative services. The hospital employs outcome measures to assess patient health impact, including patient reporting, outcomes, and evidence-based practices. They focus on reducing errors, ensuring care continuity, increasing staff levels, analyzing data effectively, and using electronic patient records to improve outcomes. Evaluation data is used through formative evaluation, evidence-based models, and primary data collection to enhance program planning and public health strategies. Policies in action. Connecticut lawmakers aim to address healthcare access issues by strengthening the healthcare workforce through pipeline improvements and analyzing nursing program applications. The state has seen growth in the healthcare workforce, particularly in the number of registered nurses and licensed practical nurses. Efforts are also being made to extend Medicaid coverage to children without legal status and expand eligibility up to age 25 to improve access to primary and preventative care for low-income adults. Medicaid expansion in the past 10 years has increased healthcare access, utilization of preventative services, and management of chronic conditions while reducing reliance on costly emergency room visits. Policy implementation. The Connecticut Department of Public Health oversees public health services in the state with an annual budget of $1.2 billion, primarily funded by federal funds. Connecticut Department of Health cooperates with local health departments to serve the state's 3.6 million residents. The agency was accredited by the Public Health Accreditation Board in 2017. Connecticut's Medicaid program, with a total cost of $7.9 billion in 2022, is funded by a partnership between the federal government and the states. Impact on Northeastern Connecticut. Connecticut's Medicaid expansion, Husky D, has reduced the state's uninsured rate, increased Medicaid revenue, and improved health outcomes for low-income adults. It has expanded coverage for children and addressed the opioid crisis. The Public Health Workforce Development Plan has boosted skilled public health workers in Connecticut through legislative action and initiative like Connecticut Health Horizons and partnership with educational institutions. Potential improvements to policies. Payment reform is vital to healthcare to shift focus from volume to value. States can use Medicaid market power to create new payment models, align incentives with desired outcomes, and improve data transparency. During the pandemic, governors removed barriers to healthcare licensure to aid recruitment efforts. Collaboration between governors and legislators is ongoing to expand healthcare resources, improving coordination between primary mental health, behavioral, and oral health professionals can enhance access to care. Social work advocacy. Social workers advocate for Medicaid expansion by sharing personal and client stories, connecting with stakeholders, and promoting social worker involvement in healthcare. They also enforce mental health parity regulations, support policy development, and lobby for legislation to increase social workers in healthcare teams. Advocacy efforts focus on professional development, fair compensation, and collaboration in patient care.